Welcome back, everyone. Well, chances are you or somebody you know has sleep apnea, and many with this condition wear a CPAP machine. There we go, I can spit it out eventually, while they sleep, and for a lot of people there. So joining us now is CHI Health's Dr. Aaron Robinson. Thank you for joining us today.
Happy to be here.
So you're talking about a procedure today that can help out with that. You can maybe avoid that big, bulky machine a little bit. Can you kind of just explain first, like, what exactly sleep apnea is?
Yeah, so sleep apnea happens when we fall asleep, our body relaxes, and all of the tissue in our throat can collapse backwards and basically block our airway off. And when that happens, our brain needs oxygen, so it wakes us up throughout the night to get that oxygen, causes us to gasp or snore. And so it's a big problem.
Yeah, it's not a lot of fun. I know a lot of people that have it. What are some treatments that are out there right now currently?
Right now, the best treatment is CPAP, which is a mask that you wear on your face, and it pushes air into your throat to stent open the airway. In the past, there have been lots of surgeries to kind of try and address that, none of them very successful.
And you actually have a little device here to talk about this procedure that you're working on, right?
So this is called a hypoglossal nerve stimulator. This is a little device that we can place into the neck and into the chest. Through the neck incision, I find the nerve that controls the tongue muscles, and I can put a little cuff around it. And that lets me send an electrical current up to that nerve and make the tongue move out of the way. This device goes into the chest, kind of like a pacemaker for your heart, and it tells the nerve when to move out of the way. So a patient will breathe in, it'll send a signal to the tongue and move the tongue out of the way so they can breathe at night. The convenient thing about it is no mask. You take a little remote control, you put it over the chest, and you turn it on before you go to bed.
A little less bulky than that big machine with the mask.
Exactly.
Like that. So who's a good candidate for something like this?
Anybody who can't tolerate CPAP is a good candidate. That's a good place to start. Typically, you have to have a moderate to severe sleep apnea and not be severely overweight, but most people who can't tolerate CPAP would be a good candidate to get evaluated for this device.
Who are those kind of people that can't really tolerate? Is it just somebody that doesn't like the big bulky thing there?
Yeah, so it could be somebody who has claustrophobia, or they pull off the mask at night, or their bed partner keeps elbowing them because it's making a lot of noise, or it's uncomfortable, or they get a rash.
Okay, that sounds good. And, if somebody wants to see if they qualify, what sort of steps should they take?
First and foremost, assure that you have been evaluated for sleep apnea and have been using a CPAP. And then calling my office, CHI Health Clinics, ENT Nebraska, we can give you lots of information and direct you to the right resources.
And just for my own curiosity, how invasive is that surgery?
It's about a 2-hour surgery. It's outpatient. You get a small scar here and a small scar on your chest. So very easy, actually very well tolerated, minimal pain.
You can find all this information up on the CHI Health website?
Correct.
All right, awesome. Aaron, thank you so much for joining us today.
Thank you. Thanks for having me.
All right, sounds good. We're going to be right back after the break, everyone. Please stay with us.